Well, many veterans who do make it home are still fighting a war from within.
There was that constant thought of that I almost died in combat.
Former National Guardsman Fred Minnick suffers from post-traumatic stress disorder. Minnick photographed the horrors of Operation Iraqi Freedom. In 2004, a rocket-propelled grenade landed next to him but didn't explode. Yet that near-death experience led to anger issues, anxiety, and alcoholism when Minnick returned home. His therapist told him to put his feelings down on paper, and a year later, Minnick finished the book, Camera Boy.
Here in Louisville, I think people can be very proud and appreciative that we do have a very good system here that really does a good job at taking care of the local vets.
Some 20% of Iraqi Freedom vets complain of post-traumatic stress disorder symptoms.
For vets returning from duty, getting back to their daily lives and routines isn't easy. Besides traumatic stress, many of them are also recovering from various injuries. Natasha Collins tells us about a new program hoping to lend a healing hand.
And it's just a way for us to try to make something good out of some things that have been so bad.
President of the American Academy of Facial, Plastic, and Reconstructive Surgery, Dr. Donn Chatham says the organization looks to right wrongs when it's within their power. Already offering international humanitarian and domestic violence pro bono services, about a year ago they came up with Faces of Honor. About 20% of survivable injuries from Iraq, Afghanistan involve the face, head, and neck. Our experience, our collective experience, has to do much with facial reconstructive surgery. And so it seemed that our members could offer their services to many of these brave men and women who served in these countries. From wartime IED blast injuries to wounds from projectiles, bullets, burns, and explosions, some 190 of the organization's 2,600 doctors are volunteering with Faces of Honor nationally, hoping to help support a system they feel is doing its best. So this is not really to compete at all with the military or veteran system, but it's meant to complement the care. We've taken some time to put it together, recruit volunteers, build our system, construct a website, and just a few weeks ago we activated this and announced it on a national level. Service members returning from duty who aren't close to a veterans facility offering reconstructive surgery for the facial area can click on the website's link and find a volunteer surgeon who can help assist with their treatment and offer expertise, lending their healing hands to the faces who have kept America safe. Natasha Collins, WLKY News.
Because the program is new this year, the surgeons have not gotten the opportunity to work with any patients yet. If you're a vet interested in more information, log on to WLKY.com. Just click on the Seen on WLKY portion of the homepage.